North Carolina Senator Tom Tillis announced today that he will have surgery for prostate cancer. This comes as the Republican is only a few months into a second term. CBS 17's Russ Bowen is following these developments. This is something that affects a lot of men. In fact, just this past December, my brother was diagnosed with prostate cancer as well. So I know it can be a scary situation for family members. Senator Tillis, though, we're told was caught fairly early.
Yeah, well, first of all, I hope your brother does well. That is certainly what the senator is telling us today. And according to medical professionals, prostate cancer does occur more often than you might think.
Senator Tom Tillis' work at the U.S. Capitol will come to a pause next week as he undergoes surgery for prostate cancer in North Carolina. The senator says he had no symptoms when diagnosed after an annual physical that included a prostate-specific antigen, or PSA, test.
Prostate cancer is quite common. And a certain number of men who are in their 50s will have an abnormal PSA test if they decide to have that test with their doctor. That will then lead them to go down the path of a biopsy.
And getting a biopsy is what Tillis says came next. Dr. Ethan Bash is the physician-in-chief at NC Cancer Hospital. While he can't comment on Senator Tillis' diagnosis, Dr. Bash explained the typical next steps.
Often a biopsy to look at the tissue itself, the prostate itself, is the next step. And then based upon that, a shared decision can be made about whether or not to have surgery, radiation, or continue to watch.
Tillis says he has opted for surgery. According to the Mayo Clinic, patients can normally resume their daily routine in 4 to 6 weeks. Dr. Bash reminds men to have discussions about screening for prostate cancer with their doctor.
So for men who are in their 50s and 60s, generally it's recommended by guidelines to have a discussion about the pluses and minuses of having a blood test for prostate cancer. For men younger than that, if they have a family history or if the patient is African American, then at that younger age there should be a discussion about testing.
Tillis turned 60 last August, so falls within those guidelines. For men older than 70, Dr. Bash says a PSA test is not recommended.
And Senator Tillis also reminding people that early detection can save lives. He's received a number of well wishes, as you can imagine, from his fellow members of Congress. Guys.